It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, he's been going to Vietnam for 15 years performing podiatric surgery, and he's been doing it for nothing. Why Vietnam, and why has he been going to Viet for 15 years? It's an interesting story. You remember I had him on the show last year. It's Dr. Thomas Kashuk, who is a podiatric surgeon, and he's from Greater Hazleton, and once in a while he'll come into Hazleton to visit his family, and it's my pleasure to have him on the show. Hey, Tom, it's nice to see you.
Thank you so much. It's great to be back.
It was a nice show we had last time. We learned a little bit about the Vietnam project. Tom, so you're a podiatric surgeon?
Yes, foot and ankle.
Yeah. Mm-hmm. Now let me ask you, why did you, decide to become a podiatric surgeon?
It just kind of happened. I actually wanted to be a veterinarian of all things, and my roommate up at Wilkes College had gone to the California College of Podiatric Medicine. I had gone out to visit, and as I was doing all my application processes, he talked me into putting in an application, and before you know it, I'm moving to San Francisco.
So so right now you're working for Kaiser Permanente.
Correct.
Now, what is Kaiser Permanente?
Kaiser is the largest medical group in the state of California. There's 19 hospitals throughout Northern California. They do split it between North and South. 20 hospitals in Southern California. Northern California alone has about 7,000 doctors, and we treat almost 3 million patients. I'm in Fresno, and I've been there since 2003. Prior to that, I was with the San Jose Medical Group.
So you're working for Kaiser?
Yes.
Yeah. Do you ever think of doing it yourself?
I started out, but really it's quite difficult even back then. And I was more in tune with institutional type of medicine. And I enjoyed teaching, so early days I was worked with the VA Palo Alto and Stanford residency program. So that kind of got me interested in what I'm doing now.
So, Tom, it's interesting when, like Jack Palance was from this area,
yes,
okay?
Yes.
And Jack was, born and raised here, and then, of course, I had the pleasure of working with him for 37 years, my wife and I, Debbie and I. And one thing about Jack, he came from a great family, okay? And he brought those values with him to California and was always proud to say he was from Latimer Mines. You always kidded me about being born in Partysville. My father played with him. But I'm saying that for a reason, because when you bring, what did you bring from a Hazletonian over here to California?
Well, I think family values. My entire family, both sides, the Kaschak and the Galicchio side, I was raised in a very tight-knit family, very religious, and a lot of those values and importance of life, I think I took that with me and expanded it in California. But it's always nice to come back home. I do refer to Hazleton as my home, always will be. But California is where I am now. So
now, and we discussed the drought situation,
yes,
which is very sad out there. But when you started, your podiatric surgeries, okay, how did this Vietnam project thing develop? I mean, we're going to show you pictures, folks, of what he does over there and the whole reason. So what happened?
Going back to when I was involved with the residency program at VA Stanford, one of our former residents, his name's Pat Code, he had the opportunity to go there in '97. His office manager had a brother who was killed in the war. They never found a body, and she was going back more or less for closure. He connected with the hospital that I now connect with, and he thought it was a great experience. And he thought the residents might benefit from that. So several of the residents did want to go back, but they needed an attending.
What did he do?
He was doing foot and ankle surgery there. At the time, it was the Da Nang Orthopedic and Rehabilitation Center, now hospital. And he thought that this would be a great experience for the residents. I went with them thinking, wow, once in a lifetime opportunity, but I got hooked.
When you went there, okay, so he went there only because to find out?
He went there the first year just to accompany his office manager, and he thought maybe I could do something while I'm there. Okay. And it started everything.
When you went there first time,
yes,
okay, what did you see?
Well, maybe we can look at pictures. The first thing we saw, I was thinking in terms of the practice that I had.
This is what we're looking at.
And so this is the clinic. It was actually, the whole place was built by the U.S. during the war. And this is the old clinic.
Now, this is what you saw the first time.
First time. And
this is at Vietnam.
This is the waiting area. But I'm expecting more or less a foot and ankle practice as in the United States. And the next picture will show the very first patient we saw, a young boy with polio being carried in by his mother. And I realized, wow, this is a little different than what I had expected. And one patient after another, we could go to the next one, we could show these two little girls. They came in on the back of their dad's bicycle. It took them 2 days to get there. And they have those congenital deformities, which unfortunately are very difficult to correct and often lead to fractures. We had hoped to be able to see them again the following year, but we never connected again. The sad story was, like I said, they came in on a bicycle, and our interpreter at the time said, oh, we should give them bus money. So we ran out to try to give them some money, but they had disappeared into the traffic, and unfortunately we hadn't seen them again. But
did you do surgery on them?
No, we never did. And this young girl, you can see she has 2 club feet. I corrected her her left foot, and with there she is, and she was crying. This is the day after surgery, and I'm expecting that she's crying because of pain, but through the interpreter, she said no, she was just crying because she saw that her foot was straight. And they were supposed to do the other foot, the doctor's there in 3 months, but she wanted to wait for me, so the following year I corrected the right foot.
Okay, so this is the first time.
This is the first time.
Hold the pictures a minute, Sam. This is the first time that Dr. Kaschak went to Vietnam, okay, because a friend of you asked to go there.
Yeah, he kind of opened the doors for us.
Okay, so, and I'm going to show some other pictures, but the point is, what were you thinking?
Well, I was thinking that this is something that was maybe too much for me. And but after everything, I thought, I got to go back and make this right, and that's what brought me back the next year.
Okay, so you decided when you went there that this was something. So we're going to show more pictures when this the first time you were there. Okay, folks, I'm talking to Dr. Tom Kashuk, who is a native of Hazleton. He is now working for Kaiser Permanente in California, Fresno, and started this Vietnam medical project. Keeping in mind they do not get paid for this, and keeping in mind he does this gratis. Okay, my question when we come back, you will see some more pictures and the humane part of our lives. How important is that? Stay with us. Welcome back to the Sam Lesante Show, folks. Remember, 24/7. You can watch all of our shows in HD, ssptv.com. My email is sam@ssptv.com. My guest today, Dr. Tom Kashuk, who is a podiatric surgeon from California, is a native of Hazleton, and started a project called the Vietnam Medical Project. So, okay, we showed when you went for the first time. Okay, once again, you went because this doctor said, come with me, Tom, I want to show you what we're doing there. And he went there because he was looking for his brother, or...
No, his office manager was looking for closure with her brother. He actually didn't go back again, unfortunately, but he passed the torch, so to speak.
Okay.
And after that first year, again, I was just so uncomfortable with myself that I was so unprepared, not only skill-wise, but equipment and things we needed to fix the problems we saw. And at first, I was a little hesitant to even consider going back. They had invited me to go back.
So the first trip. Let's go back to the first trip, and then we'll talk about. So here are some of the patients, folks, on the first trip. Okay. Now,
yeah, this little guy, he's actually from up what's called Dom Ha, near the old DMZ, and he was brought down. He stepped on a landmine. As you could see, he had some very severe injuries. He's blind, and he has shrapnel all over his face. It was interesting, a few months after we saw him, we were watching a special with Paul McCartney's former wife who had lost her leg, and he was on her program. But we were able to get him down to Da Nang. They fitted him with prosthetics and had him working with his left hand on computers. So the news was good about him, but he was saying something the whole time we were there. And I asked the interpreter, what is he saying over and over? And he was essentially saying, I want to die, I want to die. And so it's very sad, but at least we were able to give him the opportunity to have another look at life. This is the operating room. You can see two tables side by side. At the time, it was just one anesthesiologist going back and forth. The interesting thing was when the new hospital was built, and we'll be looking at that shortly, I was happy that we're going to have 3 operating rooms. The main operating room, 2 beds side by side, but 2 anesthesiologists. And it actually is quite efficient. The infection rate is quite low, and it works out well. So it's something we just kind of got used to. Never would happen. Yeah, this is an interesting picture. This is pre-digital film. A lot of these kids never saw themselves in pictures, and that's my wife Sissy in the middle. We had gotten the pictures developed, and she was getting them out, and they were just having a wonderful time. As she was,
can you imagine?
Yeah.
The things we take for granted, these are big things for them.
That's it. Now the new place.
This is the new place. Okay.
Yes, this was built in 2009, and I have to give my wife again credit for picking the color schemes. They brought me out of surgery one day. What color should we paint it? And they asked her, and there you go.
Wow.
But yeah, this was built in 2009, and it's a wonderful, wonderful building, and we're proud that we had a part in getting this built there. We met with people up in Hanoi and the government who were actually going to close the center, and the director brought us up there and asked us if we could put a pitch in, and not only did they keep it open, but they built a center. So we're proud of any part we played. This year actually, the new clinic exam room, a lot of residents and doctors and everything there. We sometimes will have 2 or 3 patients with many doctors and so on in the same room examining patients, and it's not as private as it is here, but it works very well for us there.
This is this current year, right?
Yeah, this woman, she has an interesting story. You can see her leg. She was injured during the war from a landmine, and she lives alone. She runs a little farm, and she's been carrying this wound with her the whole time. There's a friend, one of the surgeons, who is showing what we had to do. She expected it. She has a bad infection in the bone, so she needed an amputation, a below knee amputation. And these are shoes she fashioned to be able to keep on her feet. You get little flip-flops with a string to hold it on. But she became emotional when we verified that, yes, indeed, we do have to take the leg. But the surgery went quite well, and she had her prosthetic leg actually made quite recently. But this is a typical story. A lot of these patients still carry the scars of the war and need help to this day. Our doctor's lounge after a long day, that's Dr. Tan, who he calls me his big brother. Actually, it translates old brother. Yeah. And he now is he runs the hospital. He's we had him to the United States several times, one time for 8 months, and he's become an extraordinary orthopedic surgeon. And he just does a great job. One thing we used to see a lot in the past was club feet. And he studied for 1 week with a gentleman in Iowa, Dr. Ponsetti, who developed a method for casting in infancy. It was poo-pooed initially, but then it became the standard. And he spent a week with him. He goes all over Vietnam teaching it. So it's rare in the last 10 years that we see anybody with club feet because they're caught so early. Wow. Young child who had a major surgery, both up and lower extremity, and just to show you sometimes what we have to put these poor kids through. They usually stay at the hospital until they're recovered. This one might be there for about 3 months.
What was wrong with that person?
She had a congenital hip deformity.
Okay.
This little girl, she's just a sweetheart, just kind of waving to us. You can see she has a hand deformity there. The plastic surgeon who is the doctor there, Dr. Key, Buxy Key, he did a little work on her, mostly on her other hand. There's not, unfortunately, too much you can do other than a prosthetic device for this. This little guy, here's my wife getting her picture taken with him. You could see his middle fingers are fused, but we were able to, similar on his foot, I took care of his foot, and the orthopedic surgeon who does plastics took care of his hand. He was a sweetheart. He would follow us everywhere. And I had the honor this year to be given the Medal of Honor from Melissa, Ministry of Labor, Invalids, and Social Affairs for the work we've been doing. One other person got it, Pat Code, who was an undergraduate of mine in medical school, podiatric medical school, and he got it just a few months earlier. The award was actually given, and if you could see to the left of me, Hong Van Koop, he was the former clinic director, but he wanted to make sure the award was given under his auspices, so it's actually August 14th, and then it was presented to me at our most recent trip in May, June, and that's Baxi Tan, Dr. Tan, who is announcing it. He got a little tearful, as did I. And
what is this award all about?
It's just people get this award for helping the people of Vietnam.
This is your entire crew now?
This is the crew with much of the staff that was there at the ceremony and who we've been working with over these last years. And there's my cousin Amy Nelson, Christian Kaschak on the right, who is an aspiring medical student, and he got to do some surgery there, and of course my wife next to me.
That's great.
This just shows some of the kids we saw. This poor guy has cerebral palsy. We were able to do some surgery to take the tension off of his leg so he could be fit in a prosthetic device. A charming little guy, smiling all the time. This little guy had an injury. It's a little hard to see on this picture, but you can see his right leg. There it is a little better. These are difficult because there's so much contraction of the tissue. Sometimes if you try to do too much to correct them, you actually stop the blood supply and they end up losing the foot or leg. This little guy, just big smile. He had both hand and foot deformities. You can see the hand deformity there. The doctor, Key, took care of that, and we were able to do a little foot surgery. He had an extra big toe that I took off on both feet. This little girl, she also had cerebral palsy. Her problem was mostly with her hips and a bent over gait. The orthopedic surgeons we brought with us this year were able to correct that so she could be braced and go through physical therapy. They're darling children. This is a nun who we saw a few years ago, and she came back. She had an injury to her foot, not related to the war. There's one Catholic church in Da Nang, and we always see her there. But unfortunately, I had to amputate the end of the foot because she had a fulminant infection in the bones. But she did quite well, and she took it in stride. Another little guy, where this one has a club foot that we were able to correct, fortunately, and he did great. And just I had to prove that I do actually do surgery there. That's
like
me.
We're not going to believe you, right?
Yeah, that's me to the right. In front of me is my cousin, Christian Kaschak, who we had remodeled this foot, and of course we had to put some screws in, and I was able to allow him to do that. And I'm hoping that it does indeed pique his interest in becoming a pediatric orthopedic surgeon. And here you can see that other operating room table behind us there. So there are still two people there, or two tables there. This is Mr. Cook, who runs the clinic, or ran the clinic. He just retired a year ago this month. And he's been a wonderful guy, wonderful mentor. And if it wasn't for him and my wife, who has been so supportive and encouraging, that's the reason we go back every year. And to the left, you see her name is Nga. She actually is the one who runs everything. The guys get the credit, but she does a wonderful job. That's Liam, the physical therapist behind her. And to the right is, again, Dr. Tan, who now runs the clinic, and he's a very dear and close friend.
Let me make a special note here. I'm talking to Dr. Tom Kashuk, folks, who is a podiatric surgeon, and he's a native of Hazleton, and he's been going to Vietnam doing this project. And if you tune in the beginning of the show, it tell you why he ended up in Vietnam and not Japan. But interesting enough, folks, if you remember Sister Sponsa, who was on my show a while back, in certain parts of Africa and in China, in different areas, those young, beautiful children that you've seen who had deformities, they just leave them in the streets. They just discard them. Isn't it? And it's very, and we're all people. Right. We're all people, Tom, and it just breaks your heart to see how human beings could be what they do. It just, I'm sure when you go there, I know you're so excited about what you do, okay? And I said before, you don't get paid. Right. This is something you pay for, but how it makes you feel. The thing is that, when we come back after break, folks, I'm going to talk a little bit more about what's the whole reason and purpose here of what we do and how we can help other people, whether they're our neighbors, whether they're down the street, whether they're in a different state or a different country. Stay with us. Welcome back to the Sam Lesante Show, folks. 24/7 SSPTV.com. My guest today, Dr. Tom Kashuk, podiatric surgeon from California, native Hazleton, has this project called the Vietnam Medical Project. Just won a major award for it. Now, you've been going there helping these unfortunate people. Okay, what is the lesson, okay, so that we can learn? Because sometimes people want to help people, and we work, a friend of mine says he deals with humans, not color, not race, not Democrat, not Republican, okay? What lesson could you give us?
What you have to do is look at people who, they're just like you, no matter where they're from, what they look like, what color of their skin. And you just have to have just an appreciation for life, and particularly young children. I have a soft spot for young kids, animals, and the older folks. Anyone who is just unable to take care of themselves. And I like to encourage others to develop these likings in within themselves, and whatever way they can, help in any way they can.
The interesting thing, when you're reading the Bible, when the person gave talents to certain people, some people took those talents and multiplied them. Some of them didn't. Some of them saved them or whatever. And it's unfortunate we have so many people out there in the world, especially in our own hometowns, that have so much talent that can give and help other people. But unfortunately, Tom, there's such a thing called greed, and there's such a thing called jealousy. And sometimes other people like to see other people fail, okay, just because, they're either envious of the person or jealous. And instead of being helpful and pray for that person, okay, it's very difficult. In the Bible it says pray for enemies. How can I pray for that guy when he was, how can I pray, but however, you have to open your heart up, I think, don't you think?
You do. And one thing that the clinic director said, it just came to me many years ago, and I had asked him, and he said, why does your group come every year, And or I said, why do you invite us every year? He said, because you come for us, not for you. And we've seen other groups who have gone who are more or less self-promoting. And I did become disturbed with seeing a lot of that. But hopefully we'll be able to continue doing this well into the future.
Well, you invited my wife and I to come over.
Yes,
there.
Please come. Please come.
Debbie's excited about it.
Great.
I'm a chicken because I don't like to travel that much, okay? I'm always nervous about planes, etc., because I'm a big baby. There's no question about it, okay? But it's always a pleasure talking to you, Tom.
My pleasure being here. Hope to see you again.
Okay. Dr. Tom Kashuk, folks, podiatric surgeon for California. Been going to Vietnam for 15 years, helping a lot of unfortunate people and making a lot of lives happy. We'll see you next time.